If you're having an operation, you may be given general, epidural, or spinal anesthesia to put you to sleep and keep you free from pain. Your doctor may recommend a general anesthesia for a procedure that is extensive, takes a long time, or requires you to be in an uncomfortable position. Before the procedure, an intravenous line will be placed in a vein in your arm using a small tube called a cannula. The IV will deliver fluids and medications directly into the bloodstream. You may also receive some medication to help you relax. You will be also placed on the operating table. A blood pressure curve will be placed on the arm to check the blood pressure readings. Sticky pads will be also placed on the chest to check the heart rate, and a clip will be put on the finger to check the body's oxygen levels. These devices allow the anesthesiologist to closely monitor the vital signs before, during, and after the procedure. You will begin receiving general anesthesia by either breathing anesthetic gases through a mask or through an intravenous injection, which will cause you to fall asleep. Once you are asleep, you will be given a mixture of oxygen and anesthetic gases either through a mask or through a special tube inserted through the mouth and into the windpipe. The tube is attached to a respirator which helps you to breathe while delivering the gases to the lungs. Deep in the lung tissues, the gases are absorbed into the bloodstream and carried by blood cells to the brain. The anesthesia prevents the brain from receiving messages from the nerves in the body. As a result, you remain asleep and pain-free during the procedure, and you have no memory of it when you wake up. If you are having certain operations such as pelvic, hip or leg surgery, your doctor may avoid a general anesthesia by having the operation under spinal or epidural anesthesia instead. Both spinal and epidural anesthesia involve injecting medications near the spinal cord. This makes you numb from the level of the chest down to the feet. Advantages of spinal and epidural anesthesia include the ability to be awake during the operation and to avoid risks associated with general anesthesia. Prior to receiving spinal or epidural anesthesia, the anesthesiologist will use an antiseptic solution to clean the area of the back where the medicine will be injected. To decrease pain from the needle stick, he or she may use or instill a local anesthetic directly where the spinal or epidural needle will be inserted. Spinal anesthesia involves a single injection of medication into the sac of fluids that surrounds the spinal cord. To reach this fluid sac, the anesthesiologist will pass a needle through the skin between the vertebral bones and finally through spinal ligaments and the dura, which is the protective membrane around the spinal cord. Spinal anesthesia begins working almost immediately after the injection is completed. With epidural anesthesia, the needle does not penetrate the dura and medication is deposited just outside the sac of fluids that surrounds the spinal cord. Epidural anesthesia may be given in a single dose, or the anesthesiologist may leave a tiny flexible tube or catheter in place in events where more anesthesia is required during a longer than expected procedure. Epidural anesthesia takes about 10 minutes to begin working. After the injection of spinal anesthesia or the removal of epidural catheter, a small bandage will be placed over the area where the needle was inserted.